My name is Dr. Steve Slava Belits. I'm going to work on Dr. Vetanze today. Dr. Vetanze has degenerative joint disease, and I'm going to show you how I work on him and what I do to help him out. He has also recently just had stem cell injections from the Orthopedic Stem Cell Institute from Dr. Patin. So he is feeling better, and we are going to work on him just like we would normally work every day or whenever I do work on him. Go ahead and lay on your stomach, please. So we're going to check his pelvis, his sacrum, and his ischium. Obviously, if you can see, his sacrum is shifted to the left. It's right over here instead of being centralized in here. His pelvis is high on the left, low on the right, and high ischium on the left. Let's check his leg length. It's way off. He's very short on the right side. So what we're going to do first is we're going to level out his pelvis. For that, we're going to use this little wedge, which you're going to place right in here. I'm going to cock up the table and straighten this out. Now it looks a lot better. Actually, a lot straighter. Now we're going to straighten out his sacrum. There we go. Just one time. Perfect. Look at that. And we're going to bring down his ischium just a little bit. Right there. If you look at it right now, his pelvis is straight, his sacrum is nice and even, and the ischium is at the same levels. Now, we're going to go to his thoracic and lumbars. Being a chiropractor for 40-some years, he has developed a lot of different issues because it is a physical work. Not always the proper posture, and he does have a lot of different subluxations and restrictions in his spine. So what we're going to do is just going to do a little adjustments. Go ahead and take a deep breath in and out. Very good. And let's try and do this in the TL junction, the Thoracolumbar Junction. Go ahead and take a deep breath in and out. No, it's not budging very well in here. And we can work on it a different way, which we'll do in just a few seconds. Now, we also want to try and loosen up the muscles, which we'll use the G5 for that. I'm sure it feels pretty good. And that helps just to loosen up the muscles and to get an easier adjustment. And we'll go over every paraspinal muscles. And you can even go to a piriformis muscle or gluteus muscles in here. Now, in order to get the thoracolumbar junction and to get even better adjustments on the thoracic, I'm going to ask Dr. Vetanze to lay on his back. And we're going to put this little board in here. Go ahead. Good. Go ahead and hug yourself. We're going to do a little bit of what's called a anterior to posterior adjustment. I'm going to place my hand right in here, and perfect. I can feel a little clicks, which means the joint has moved to the full range of motion. Now that we're done with the thoracic area, we're going to go to the neck or cervical. And Dr. Vetanze responds a lot better with a traction adjustment, where we basically opening up or tractioning the whole neck, which allows the discs to open up a little bit better, get a little more fluid going in there. Just like that. And that helps, specifically for him and some other people. Go ahead and grab my hand. Come on up.
Oh, wonderful.
How are you feeling right now?
You see, that's the loosest I've been for a long time.
Yes.
I had these stem cells. Can you hear me? I've had these stem cells, and it used to be I was so fused and fixated, nothing would, it would be like a rod. This is the best I have adjusted for a long time.
Yes,
and
we
it
have.
didn't hurt. Thank God. Thank God.